Hello everyone. So let's talk today about the 6 keys of normal occlusion. So these 6 keys were developed by Andrews in the 1960s. And he really wanted to know what constitute excellent tooth positions and relations between the arches. So he decided to search for people who have excellent dentition naturally without any orthodontic intervention, so that he can study them. So he gathered a sample of 120 subjects and took impressions of the teeth. And he tried to search for common characteristics between those 120 subjects. And he found 6 common characteristics between them, which is known now as the 6 keys of normal occlusion. So these 6 keys include molar relationship, crown angulation, crown inclination, rotations, tight contacts, and occlusal plane. And of course, each one of these keys have a specific criteria, so let's know them one by one. The first one is molar relationship. And the normal molar relationship is a class 1 molar relationship. And this of course includes 3 main points. The first one is related to the mesiobuccal cusp of the maxillary permanent first molar, and the second is related to the mesiolingual cusp of the maxillary permanent first molar. And the last point is related to the distal surface of the distal marginal ridge of the maxillary first permanent molar. The second key is the crown angulation. And the crown angulation is really the mesiodistal tip of the long axis of the crown. So this is just an angle that's formed between the long axis and a line drawn perpendicular to the occlusal plane. And this angle is said to be positive when the gingival portion of the crown is distal to the incisal portion, and vice versa. So in normal occlusion, this angle is positive for all teeth. This means that the crowns should have their gingival portion distal to the incisal portion. What about the crown inclination? It is the inclination of the tooth in the facial lingual aspect. And it is also an angle, but this time it's an angle formed between the facial long axis of the crown, viewed from the sides, and a line drawn perpendicular to the occlusal plane. So the crown inclination is positive when the gingival portion of the crown is lingual to the incisal portion, and the opposite is true. Andrews found out that the crown inclination was negative for all teeth except the maxillary central and lateral incisors. And the inclination was almost the same in the canine and premolar teeth, while it was found to be more pronounced in the maxillary molars. While in the lower teeth, the lingual crown inclination increases in a progressive manner from the canines to the molars. Now let's talk about rotations. Of course, in normal occlusion, teeth should be free from any rotations. And as we know that when molars are rotated, they occupy more space, while the anterior teeth occupy less space when rotated. The fifth key is tight contacts. And in normal occlusion, there should be no spaces between teeth and contact areas should be tight. The last key is the occlusal plane. And the occlusal plane is an imaginary line in which the teeth meet in occlusion. In normal occlusion, the occlusal plane should be flat or nearly flat. In other words, if the occlusal plane is not flat, it could have a deep curve or exaggerated curve of Spee, or a reverse curve of Spee. And a deep curve of Spee results in a more confined area in the maxillary arch and more space in the mandibular arch, while a reverse curve of Spee results in excessive room for the maxillary teeth and less for the mandibular teeth. So these were the 6 static keys of normal occlusion created by Andrews, and I hope you enjoyed this video.